I'm a registered nurse and a research coordinator here.
A first-year PhD student and a practicing pharmacist.
Just basically lab manager, or you can say research manager for neurogenetics lab.
So I'm an associate professor here at the University of Calgary in the Department of Medical Genetics.
After years of working as a pharmacist, I wanted to do more for patients than I could do as an individual clinician by researching novel ways to improve the care we provide.
So anyone that's taken antidepressants knows that often you have to wait 6, maybe 8 weeks before you actually know, is this going to work? And unfortunately for a lot of people, it doesn't. And so they have to start that process again.
One of the biggest reasons that pharmacogenetics caught my eye is I used to work with treatment-resistant mental illnesses. So these were individuals who had tried pretty much everything under the sun and were now looking for novel therapies. And for a lot of them, there was a lot of that trial and error and things weren't a fit. And it just made you wonder, what if people had gotten connected to something that was a better fit earlier on?
When someone's starting a medication, there's a lot of uncertainty, there's some anxiousness. So pharmacogenomics, you can think of it as a marriage between pharmacology and genetics. We use genetic information to help determine how drugs are processed by an individual.
We look at different drug metabolizing enzymes, and some people are fast metabolizers, meaning they clear a drug quicker than most other people, and some people are slower metabolizers.
So we are able to extract the DNA. We bought a robot, it's called QIAsymphony. We are able to extract 96 samples at a time.
We'll do the testing, and then we've created a nice report that we send both to that person and their physician, and they can use that to help inform prescribing.
One thing that's very promising to me is, first of all, a lot of families want this testing. They find it beneficial to them. Even if they don't get something that they can immediately act on, there's often useful information that they are happy that they have.
Yeah, so we have our flagship project, which is called PGx Spark, which is pharmacogenomics supported prescribing for kids. That started in 2020 and has been going ever since. To date, we have received referrals from over 300 physicians, and we've tested over 1,300 children and adolescents.
I love the stories that we get where there's an aha moment, and then you get those results back and it's aha, I know exactly why you were likely to have side effects from that particular medication, and to see them feel like they have an answer for it and they have a little more confidence in the plan going forward. And it isn't just one specific story. It doesn't happen for everyone, but it happens frequently enough that it's just very satisfying to see those light bulb moments of that's why, and this is what we can do next.
As a pharmacist, I would really love to see pharmacogenetic testing as another tool that clinicians like myself have to work with people in navigating the different medication options for them, personalize their medication therapy, and partner for improved outcomes.
There is a role that something like pharmacogenetics can play at multiple stages, but really in a key way in very early parts of this continuum of seeking mental health treatment. That was a really encouraging thing for me that drove me to want to work in this area.
And so pharmacogenomics gives us that option of trying to cut that trial and error process down. Maybe not eliminate it for everyone, but at least cut it down and make it a little less uncertain when you're starting antidepressants. So I think that is not only the hope, but we're actually delivering on that hope for many patients through pharmacogenetics.